Um, so I'm going to ask, good morning, everybody. I'm going to ask if folks can see my screen. There we go. Okay, not yet, but you will be in just, there we go. So good morning, everybody, and welcome to the cost of containment, returning to the new normal. And I've got funky things going on here. There we go. Okay. My name is Diane Barber, and I will be your host for this morning. I'm the executive director of PACA. We have, believe it or not, we have quite a large group on our webinar this morning. What we'd like to ask you to do first is if you would please sign into the webinar by entering your first and last name into the question box. If multiple people are viewing this webinar at one location, hopefully you are staying 6 foot apart. Please enter all names of the viewers. If you are on a tablet or phone, the question may appear somewhere else on the screen. Usually it's a little like a mic or a little kind of little icon that appears at the top of the screen. We have 1,000 people registered for this webinar. We reached the capacity. We've never reached the capacity of PACA's subscription to GoToWebinar. So this was obviously a topic that people wanted and need to talk about. Attendees are in listen-only mode, but to be sure, please mute your computers and phones. During our last webinar, some folks had shared the call-in number, and unfortunately, we couldn't then mute them from this side. So please mute your computers and phones just to be sure. If you are having audio issues, you can't hear me actually say this, but click on the audio button and select telephone, and a drop-down menu will display a phone number you can call to hear the audio of the webinar. Technical support at any time for those who can hear me is Teresa Ryan, and that's her phone number or her email address. Because we have so many people on the call today, and we know that you have lots of questions, and we'll have, we hope, lots of really good comments to share with your colleagues, we ask that you use the following technique to help us monitor the questions. Maureen Murphy and Sean Toohey are going to be looking at the question box throughout the webinar. But what we're asking, if you have a question, if you would type a question mark and then type your question into the question box. If you are making a suggestion, if you could type the exclamation point and then type your suggestion into the question box. Again, we are monitoring the questions, and we will have opportunities throughout the webinar to ask questions. Before we get, let me introduce our panelists. We have with us today Tanya Bastinelli, who is the director of the PSCCU Child Care Center, which is part of Bright Horizons in Harrisburg. We have Tina Butts, who is a family child care provider in Pottsville. We have Karen Grimm-Thomas, Director of External Relations for Octal. We have Amy Rekwa, who is the Senior Health Manager at the PAK. And we have Maggie Rivera, who is the Director of Holy Redeemer Child Care in Meadowbrook. So before we get, and I want to welcome our panelists and thank you for taking the time this morning to join us, and 1,000 of your colleagues. So before we get started, we wanted to run 4 short polls just to give us an idea of who is with us today. So that is the first one. Who is with us today? And we're working on it. And this, I don't like it when that little, oh, there we go. Are you a director or an administrator, a teacher, a technical assistance provider, perhaps someone working in professional development, or are you part of the ELRC or STARS? If you are not one of those things, if you would type your answer into the question box, and that would be terrific. and you know how, like if you've been on webinars with me before, you know how I love to kind of watch the percentages. So we have 56% of the folks who are on with us today voting. If we could get that up to about 70, that would be good. I know it's early in the morning, and if you've been, if you've not had your first cup of coffee yet, I know I've had 2 or 3, so that's good. Okay, let's see what we have so far. So we've got sharing the results in the little, there we go. No, let's see, share the results. Come on, you can do it. You can do it. Oh, well, if it doesn't, oh, there we go. So 77% directors, and then we've got teachers, technical assistants, and professional development. So mostly we've got the folks that are running our programs, the leadership in our programs. Terrific. Next question, easy. Is your program currently open, closed, or perhaps it does not apply? Oh, this is good. Okay, so the purpose of this workshop or this webinar was to target our closed programs. So we've got, all right, let's see, 60%. Now we're moving. This is good. This is good. Okay, let's see what we have. So share. I love this. So 5% are currently open. That's okay. 89% are closed, and 6% of the folks that it doesn't apply. All right. Just 2 more questions. So for those of you that are closed, we're back to open in the next 1 to 2 weeks, 3 to 4 weeks, are unknown at this time. We do know that the governor is going to be making some announcements later today about his plan to move red areas of the Commonwealth into the yellow area of the Commonwealth. So you may not know at this point, but this is just like your best estimate of what your plans are. Okay. All right, let's see where we are. Okay, so 73% don't know, and that makes perfect sense, right? But some folks are planning to open between 13% between the next week or two, and then towards the end of this month, because it's the 1st of May. Okay, great. So I have one more question. So for those that are planning to open, okay, which is nearly everyone, what do you see as your biggest challenge in reopening your program? And you can well, it's your biggest challenge. And although some of these may apply, families won't return, staff won't return, implementing health and safety guidelines, finding and paying for supplies to keep the program clean, and other. So if you have, what are some of your other things, please do type them into the question box so that we can record them. One of the things that is happening, that all of the answers that are and questions that are in the question box, we will have available at the end of the webinar. So everything is being recorded. So if there is something that we can't answer during this hour and a half, we hopefully will be able to get you answers in the future. Okay, so this is what we've got. So as the box goes round and round. Yeah. All right. So implementing health and safety guidelines, understandably. 15% families won't return. We know that as we can probably predict that now. And one of the things that you will find as a handout to this webinar is, and down at the bottom there is a section that talks about handouts. there is, we were able to collect from PACA board members some surveys that they're using to assess parents' return. So we have 4 sample surveys that you can use if you've not already surveyed your families, that you could use to survey your families to see what kind of attendance you might anticipate as you begin to open your program. 9% are concerned about finding and paying for supplies to keep the program clean. And then 6% are looking at, staffing and whether staff will return. Okay, that's really good. So if you can see us, as you can see, and I will only speak for myself, I've been working from home for a really long time. Okay? My hair is so long, and the color, we won't even go there, but I don't know if any of you all are also in that predicament, but I can't deal with it. Okay, so it's all pulled up behind my head, and luckily my hair had pretty much turned to blonde, so you really can't see the gray at this point. So we'll have to make that decision. It's always a good time to transition, right? So, and I also have these really wonderful Harry Potter glasses, so bear with us. So on what I wanted to do next is just look at, everybody see this? So one of the pieces that we've also shared with you is the CDC guidance for opening for childcare programs that remain open. It provides some really good guidance and things to think about. So these are just kind of a checklist of things that have that are based on kind of the upper level components that they've talked about. And so, the pieces on the left are really kind of the planning pieces to begin to think about. And of course, and the CDC guidance goes much more in depth into each of these areas. And then on the right, those items are really about once you've opened your doors, okay? And the CDC guidance really distinguishes what, or provides some suggestions. Our panelists today are all operating, have been operating either under a waiver for Maggie's program at Holy Redeemer and for Tanya's program at PSECU. Tina's program, because she was a family child care provider, she did not need a waiver and she continued to operate. So I want you to take a look, download if you don't already have the guidance from the CDC, please do download them from the website or from the bottom of the page and take a look at that. I think there's really good information there. Remember, this is guidance and it is from the CDC. And we know that some of the things, and we're going to talk about it with our panelists, and also Amy can provide some really good input on how you actually do these things. Because in some ways, these activities seem counterintuitive to what we do in real life with children and with our staff and with our families. Okay, so what I'm going to do is ask Karen, I'm going to turn this over to Karen and ask Karen to please provide us with some updates from Octal. Karen.
Great, can you hear me?
I can hear you, sounds good.
Okay, well, I want to thank Diane for including Octal in this presentation. We've really found it to be incredibly helpful throughout this crisis when the our advocacy partners or our ELRCs are doing calls directly with providers, that they allow us to listen in, particularly for my role. I'm the Director of External Relations, so my position at Octal is really about coordinating our stakeholder engagement. It's about ensuring that folks in the field understand the intent behind policy, and it's also to listen and take information back and really kind of help the leadership team at Octal understand how policy is being felt on the ground and make adjustments to that policy. So being able to sit and listen and have conversations with providers who are actually either providing care for kids right now or trying to struggle with how to keep their program going when they're not, operating. This has been really, really helpful. So I have a few quick updates. Today is a big day, so a lot of what I'm going to say now is, probably by 2:30 is not going to be that relevant any longer. But we'll try to kind of pick through which parts are going to be relevant and which aren't. By now, I hope most of you have seen that we were able to take the original policy statement that paid your childcare if you have a provider agreement with your ELRC and are participating in the subsidy program. It paid your CCW rates based on enrollment rather than attendance or your operation. We took that initial policy statement that expired at the end of April and extended until the end of May. So the one thing to understand about that is that regardless of what happens with the governor's plan and the timing of that, regardless of when your area is able to move from the red to the yellow, and you could begin operating again if you're not operating with a waiver, regardless of the timing of that, those payments will be based on enrollment through May. We expect at Octal that there's going to be, you might be in an area that goes into the yellow, but there are going to be a lot of things that go, that you need to consider as a director about whether or not you open immediately. We don't expect everybody to turn around and open the very next day. We know that there are going to be factors related to your program, related to your staff. There might even be factors related to the families that you're serving and their willingness to come back, their need for care at this point. So we understand that that payment through May based on enrollment is going to be critical for you. Now, our policy folks and our fiscal folks within Octal, within those two bureaus, are already having conversations about what happens in June and how do we update that policy, and how is it going to apply in June. So as soon as they are able to get that routed up and get the approval of the governor's budget office, we'll be distributing that just like we've done everything else. We'll be utilizing that early ed news listserv, and we'll be distributing it through the certification listserv. And then your ELRC, again, is always a great source of information. They'll have, what you need to know around payments, for that. And then after June, I have to be really honest, I'm not really sure what happens after that, given that that's when we move into the next budget cycle. And I think a lot of folks have a lot of questions about what happens when we move into the next budget cycle. And so as we learn new things, we will get them out to you as soon as we possibly can. We know that folks are really curious about the CARES Act and the CCDBG dollars that we receive through the CARES Act. Again, our fiscal folks have been working with DHS leadership and the governor's budget office. We've gotten some input from folks, from advocates, from our early learning council, from different folks about how to distribute those dollars. That distribution strategy is currently still being discussed with the governor's budget office. And as soon as we know which strategy they came down on, we will make sure to publicize that. The thing to note with the CARES dollar is that prior to that, Octal's only ability to kind of infuse dollars into programs was through the funding streams that we come through, that we administer. So if you were a state pre-K program or Head Start program, we had those dollars and our CCW dollars. And CCDBG had, there were some restrictions on how we could use those dollars. So we weren't really able to do any supports for programs that rely mostly on private pay tuition. The CARES dollars do have some flexibility, okay? So we expect that we're gonna be able to do some things beyond what we've just been doing with CCW families, or CCW programs and families. But again, we're waiting for the governor's budget office to come down on a final distribution strategy, but we will get that out as soon as we can too. We know that, everybody is waiting to hear. There's been a number of things that this webinar is really going to kind of dig into the CDC guidance. And we understand that folks are a bit confused about how the CDC guidance relates to different things that are happening within the states and the statements that both Secretary Levine and the governor have made. We at Octal have made it really clear to them that the order that Secretary Levine put out in mid-April around safety for workers in essential that are in businesses that are operating, they are now very aware that there are some real contradictions between that guidance that they put out, or those orders that they put out, and the guidance that the CDC has. And so we are, working, Amy can maybe speak to this if people have questions, but working with them on trying to figure out exactly what does that mean for programs as we move programs programs are in areas that move from the red to the yellow. One of the things we've really been emphasizing with folks is that the CDC guidance is guidance. Octal strongly believes in that guidance, and Octal really recommends that you implement the guidance as closely as possible as you can. And we want to know if you're struggling with that and what kind of supports we can provide to you. But it is guidance. It is not our certification regs. So the only thing, if you're not implementing that guidance fully, your certification rep is not going to come out and cite your program for not implementing any part of that guidance. Again, we believe in the guidance. We would like to see you implement it as fully as possible. And that's a big part of what Amy's been working on for the last few weeks. And we will want to support you in that, but you will not be cited if you're not following the guidance. We want to let folks know also that Octal was able to, through the PA key, we were able to find a bulk order of no-touch thermometers. And what's going to be happening, I heard from Matt earlier, he believes that within the next couple of weeks that should be happening. So the distribution strategy for that is, we struggled with this. Octal's not a distributor. We don't really have these mechanisms in place. We do have our partnership with the NWIR, the Northwest, I don't even remember what the I stands for, something research. Anyway,
research.
Yeah, they were the Northwest Regional Key. They are ELRC1. They have a warehouse, and they've been able to do, we have some minor distribution work with them in terms of getting out materials related to stars and related to ELRCs. And so we're going to take advantage of that. The thermometers are going to go to them. They are then going to be shipping them directly to programs that are operating with a waiver. So on the day that they get them, Octal is going to provide them with that list of who is on the open facilities list, and those programs they will then ship those thermometers to them directly. There will be some additional thermometers then once that is over that will be distributed amongst ELRCs. So as programs open, you can contact your ELRC about how to get a hold of one of those no-touch thermometers. We were hoping that they were going to be out sooner, but there was quite a run on thermometers and locating those. Everybody should send a nice thank you to Matt at the key, because he was really able to find stuff. We're also looking into a similar distribution strategy, something similar with, I'm not sure how it's going to work, but he was able to locate a bulk order of some masks. And again, I'm not sure whether the NWIR is going to work for that. It's one thing to say ship each of these programs a thermometer. It's another thing to say bust open this case of 3,000 masks and start counting them and send them out to programs. So we still have to figure that out, but we're working on it. But we're hoping to have some answers for you around that too. I'm going to pause and make sure that there wasn't something that you were expecting me to say that I didn't.
The webinars. You want to talk about the webinars?
Oh yeah, thank you. I'm so sorry. I totally missed that part. So Amy is. So again, we know that there's concerns around the CDC guidance and what Pennsylvania's response is to that. Amy worked with some pediatricians and folks at the Department of Health originally when the CDC first put out guidance to do a bit of a summary for Pennsylvania programs. But the CDC guidance has changed. We're learning so much about this virus. It changes every day, and they're going to be updating those things as we learn more. So rather than, they looked into it, and rather than updating Pennsylvania's specific things, they just made the decision to just point programs back directly to the CDC guidance. But then what is happening is Amy is doing a series of, we were going to originally do them as webinars, but there's been a really big interest in them. So we've shifted to a webcast platform where each week Amy is going to, she did one for center-based providers and one for family providers on Wednesday, and they are recorded and they're posted on the PA Key website. Wednesdays was kind of a general, these are the big points about the CDC guidance. And so then each week she's going to do a recorded webcast where she gets into things a little bit more deeply, but really what we're hoping is that the content is going to be driven by your questions. So there is an email address. It went out in Early Ed News. We'll make sure to get it out to you again. that you can submit your questions to ahead of time. And we really hope that you do that, because that's really, Amy's going to kind of look through those questions, and that's what's going to really drive the content each week that she puts together for folks. And so as she does those each week, they will be then added to they'll be added to the PAKey website, and folks can go back and view those at a time that makes sense for their schedule. Yeah.
Thank you.
That's good. Thank you.
And I just have to say too, we're just really so fortunate to have Amy and her ability to do that. Her history with Head Start programs in Pennsylvania, her history with early learning programs in Pennsylvania. I think it's just, you can be assured that Amy is really familiar with what an early childhood classroom looks like. So it's not just about saying that these are best practices, but she really does have the ability to kind of help you stop and think about, because she understands that 3-year-olds are going to pull at their mask. Like, she knows these things, she's seen it. So I think we're just really fortunate that we have her. So I would really encourage folks to submit their questions and have Amy, give Amy the content that she needs to really, make those webcasts really meaningful for folks.
Thanks, Karen.
So it's 3 minutes to 11. Were there, Maureen and Sean, were there any questions perhaps in the question box that Karen could answer before we move on to the panel?
Well, there's one. Can you hear me?
Yep.
Okay.
Yes.
Will any current regs be changed to allow us to meet CDC guidelines? For example, will toddlers be allowed on a second floor if that allows them to be kept in a separate space than other children?
Right. So across DHS, all programs that have any kind of a regulatory or a licensing capacity were asked to put forward regulations that could be suspended. I know that Tanya and her staff at certification have done that, but we are waiting on a final decision on which of those regs, if any, they are going to be, that they would suspend.
Thank you, Karen. Is there maybe another one, Maureen?
Yeah, there's another question about thermometers. Family childcare providers wonder, since they're not tracked as open or closed, will they have access to thermometers?
No,
also?
they are tracked as open. The open facilities lists now, it didn't the first week, but after the first week, it's been including family childcare. So as long as they did not submit something to Octel telling us that they closed, the assumption is that they're open and they should be receiving a thermometer.
Great, thank you.
Great. We have time for one more question. Is there another right now? Is there another one?
I don't have another one.
Can I say
and I apologize. That's my dog.
Can I
Excuse
say
me.
one more quick thing, Diane?
Yes.
That I didn't mention is that part of what Octel is going to be doing, we're really hoping to, we're very excited because we are continuing our partnership with Dr. Phil Serenides. He was in the process of finalizing a cost of care study for us. They're still finalizing that, and we've been told that they're still going to be on track to put that out shortly into the next fiscal year. But in the meantime, we were able to contract with him to do an impact, a fiscal impact of COVID on childcare programs study. So he will be reaching out to programs. He wants to be doing, he's going to do a lot of the methodology that he did before, where some of it's going to be surveys, some of it will be interviews. So we are hoping that as programs, if you're contacted by Dr. Serenides or anyone on his team, to please, I know that everybody's time is really crazy, and I know that people are getting surveyed all over the place, but it's really important. We really want to be using, making some data, informed decisions. And we're excited that he's going to be able to take what he understands about the cost of care study that he's already done and kind of do almost like a follow-up to that and really give Octel some good information about what's happening for folks and what the impacts of COVID have been on your programs.
Great. And I actually have heard from people that have been contacted. So this is, awesome. So it is happening now. So watch your emails, answer your phones. This is a good thing. This is a good thing. Because with that information, Octal, as Karen said, can really begin to make some good decisions based on what the needs are of the field. So I want to thank everybody. Karen, thank you for the update. And I'd like to move on to our panelists. Again, we have with us today Maggie Rivera, who is the director of Holy Redeemer Child Care Center. Maggie's program is attached to Holy Redeemer Hospital in Meadowbrook, which is right on the border of Montgomery and Philadelphia counties, in kind of the northeast section of Philly, Montgomery. Also with us is Tanya, Bastinelli, who is the director of the PSECU Center at here in Harrisburg. It is a part of Bright Horizons. It is kind of a parent-employer sponsored program. And then we have Tina Butts, who is a family child care provider up in Pottsville. All three of our panelists are very experienced administrators of child care programs. They all are operating, Star 4 programs, and they have all been open since the start of the pandemic, and have adapted their service delivery to the needs of children and families under the guidance of kind of the CDC and the hospital. So, and I do apologize, my dog is crazy. So as soon as I open to the rest of the to the panel, I will yell at my dog. Okay. All right. So what I'm going to ask is, I'm going to ask a series of 4 questions, but I'm going to ask that our panelists each answer the one question before we move on. So I'm going to begin with Maggie, and the question is, why did I luckily I know pretty much all of these answers, but anyway, Maggie, why did you decide to keep your program open at Holy Redeemer?
Well, basically, I mean, we need the front line. At the front line, we need the essential workers, the nurses, the doctors, everybody that helps run a center, run a hospital, from the cleaning people to those who work for the food and nutrition, all the way through IT. They are all necessity for a hospital open. And with the COVID-19, we were ahead of the game in the fact that we were all communicating health system wide, which is our leadership's credibility in having us move in the direction of being proactive. So when the announcement was made, my phone immediately rang, and it was our CEO, Mike, who said, we are not going to close. And I said, we have to. It's been a governor rule. He said, we are going to fight for a waiver. It was immediate. Within 24 hours, we had sent a letter asking for specific, we wanted to make sure all health systems had the help that they needed. And that's where his focus was. So it was for our health system as well as anybody who was employed in another health system. And he got that waiver within 24 hours, and we were up Monday morning running. And as they were learning in the hospital, policies changed. I think one policy may have changed. I could be exaggerating. Several times. As the health system was learning more about COVID-19, as they're hands-on, we knew what we knew on March 12th, but we know a lot more today on May 1st. So a lot of policies were changing. They were sharing that information with us and helping us ensure we had what we needed to make sure we were being safe, 1, for our staff, and then 2, for the families. But we needed to make sure we were here so the families could go off to work and know that their children were somewhere safe, loved, cared for, and we're taking the proper protocols health-wise to keep their children healthy. Yeah. So that's why we remained open.
Great, thank you. Tanya, what contributed to the decision to keep the PSECU Center open?
So we have several essential employees here, ranging from police officers to firefighters. We have doctors, nurses. We also have staff that work for PEMA and for the governor's office. So for us, that was no question at all. It was very similar situation when that announcement was made. We were on the phone with some of our PEMA parents and talking to them, and applying for the waiver right away because we knew, and we have doctors that travel to Danville every day. So, they're at Hershey, they're at Danville, they're at Harrisburg, they're everywhere. So we knew we needed to stay open for them. And our client is a banking system and they're still open, they're still here as well. So working with our client too, to see what essential employees they were still having coming to work, who still needed care for them. And just making sure that we were following proper protocols and being safe and doing what we needed to do to stay open for the kids that still needed care and keeping them safe and providing some sort of sense of normalcy during all of this.
Yeah.
So it really was just no question at all for us.
So that's creating a sense of normalcy is I think one of our biggest challenges that we'll talk and I think we'll get to that about biggest challenges. Tina, you're a family childcare provider. So family childcare providers were not included in the governor's mandate to close centers. And it was really pretty much left, it was left on for family childcare providers to make the decision on their own as to whether they decided to stay open or to close. What was part of your decision making in continuing to provide care for children?
I decided just to do care for essential workers. To limit the exposure and took the extra precautions and everything like that. Because I was serving some before school and after school, and then with the school shut down and I could not serve those children anymore, so I eliminate the school children. They had to find other care, and I do have some essential workers, so I limited that, and of course finances. Finances play a big role in everything too, but you do get a close bond with being in the family and with your children and everything like that, and you wanted to keep that going and everything. And you want it to keep, like you said, the normalcy and everything like that. But you want it to, help out the families and the essential workers.
Great. And just interesting, could you share with the folks the ages of the children that you're serving now? I just found that fascinating.
1 year to first grade.
Yes. So it is a bit of an age span for one person to handle, but that is family childcare. So thank you. I'm coming back to Maggie. Maggie, in your opinion, what were the two biggest challenges for you as you entered this COVID-19 time?
Well, for me, it was because it was Monday morning.
Monday.
Everybody's going to be going back with a lot more knowledge than what I had. I didn't know what I was walking into. So the fear that I personally had, the fear that my staff had, and the fear that the parents had. I think the fear was the biggest factor. That fear is there, but not to the extent that it was on March 16th when we opened. Because this is our new normal. You fight that fear and fighting through it, you will get through it. It's like I said it before, it's 9/11, it's COVID-19. That facing the fear and getting up and living life again. Facing the ability that you can do that, even though this will always linger over our heads. Just like 9/11, getting back on that plane. We're getting back in the center. So that facing that fear was probably my greatest challenge. Then it was, making procedures up and going with it on the fly and figuring out this is what's new. CDC now recommends this. Okay, now we've got to implement that. I think it was more those type of challenges that I think everybody who is going to be opening up, they have more of an idea of what they're going to deal with versus what I dealt with and probably Tanya was dealing with and Tina, knowing what we were dealing with. We were learning as we went. Everybody else has a little bit more guidance to go by. So that was my biggest fears. How do I handle it? But it's worked itself out.
Right. You didn't have the benefit of kind of the CDC kind of reflecting back and saying how does this work out. Their first initial guidance was for schools and childcare settings, but now they've kind of refined that. And you didn't have that when you were opening the doors March 13th.
I was blessed at a hospital because I am connected to a hospital. It was my health system and the powers that be that guided me through this process. They never forgot about us. There was always an inclusive piece for us. We were part of the conversation all the way through, and that was a huge benefit. I think there were other hospitals that didn't get that support by our child care centers. So having the local child care group call and talk with each other, I got ideas from other people as they were getting ideas from me. So having that connection was a huge help for me. Just even over the weekend, I got to speak with Amy, which was great because there's a couple things I brought back and started implementing and talking to my staff about. So I'm still developing as we go along, but having that conversation this weekend was a huge, huge help to us. So I think this is a wonderful thing that we're doing.
Excellent, excellent. Thank you. Tanya, what would you identify as your two biggest challenges to opening during COVID-19?
So I think the first one was we came right back in Monday, the 16th, because we did have our waiver approved. And, you know, in talking to my ed coordinator, because her and I have been key in working together, was being that consistent for everybody involved, right down to the staff and helping them navigate through all of this, talking to them, you know, how are you feeling? How are you doing? As they decided they needed a break, they needed to take time off. Being there for the families, answering the family questions, you know, talking to families and giving our families the options, especially as, you know, we said, look, this is only for our essential employees. Talking to the families about what are their options, how can they pause enrollment and guarantee that they'll have spaces when we are open back up to whatever that new normal is. Right. So working families through that, helping reassure them that they'll have a space here when it's time to come back. So being that consistent for everybody and remaining positive through all of it, and, you know, being that face still of the center and that leader of the center, and still handling all of your own emotions and dealing with it. Because it's hard to watch your kids leave, to watch your families leave, to watch your staff leave, but to still transition through all of that and know that there's so much that's changing. And then I think too, just seeing all of those changes come in and taking place. Sometimes we had changes happen daily. For the first couple of weeks, we were getting new protocols, new policies and procedures, and making sure we did everything like we needed to do. And then looking at that saying, okay, this is what's happening. This is what we're putting into place. Now, how do we get the supplies to do this? You know, one of them was putting hand sanitizer outside of all the rooms when we were still letting parents walk to the doors to drop off their kids. Where were we going to find hand sanitizer? Right. So just some of the simplest things that before never would have been a thought now became, oh my gosh, how do we do that? But we did it. You know, we worked together. Because we are part of a larger company, I was able to call other directors and say, you're closed. Who has hand sanitizer? I'll go pick it up. Where can I get it? So we worked together as a team and just worked with our sister centers to say, you know, once you're opened and we can get that stuff, I'll buy it and give it back to you. So just working together as a team with our sister centers too, to make sure we had what we needed.
Great. And I should have asked Maggie and you at the beginning, you know, in the first question, but what is your typical enrollment in the program? And what do you serve it? How many children are you serving now?
We were serving 100 children. Now on a daily basis, we went from 75 to 95 children a day, but we had 100 enrolled. We're licensed for 128, but I go about the highest I will go in enrollment is 105, just for my comfort zone. But we've lost 15 children. So, but I'm not in a rush to fill those spots. I filled a couple and then I stopped because I started to think when we open back up, social distancing and having more space per child for social distancing. So I'm not rushing, and you know, to do that. You know, I'll ways to figure it out fiscally, but I think right now, until we are really confident when we're fully open that we can handle this at a larger number, because right now I have about 25 a day. That's when I'll decide if I fill the spot, when and if I'll fill the spots.
Okay, so you went from about not quite 100 to 25 is what you're currently.
And we did a furlough, and my staff's hours have been drastically cut.
Yeah. Tanya, how has your it's not enrollment. How is your attendance now? Where were you and what are you at now?
We went from about 94 a day down to about 20 a day.
Okay.
And same thing, we furloughed a lot of our staff And then we have those staff that have just been here since day one and just really watching those hours, scheduling them, and really making changes with the schedule for the ones that are still here.
Great, thank you. Tina, well, so as a family child care provider, you are licensed for 6.
Right.
How many children, how many you have, did you say you had 5 now, or was it 4?
5 1 week, 3 the next.
Okay.
It alternates.
So what do you think is, what do you think your biggest challenges have been? 2 of your biggest challenges have been?
Getting supplies, especially like cleaning supplies, rubbing alcohol, because you have to clean. I do the temperatures every day. I have the stand thermometer, and they do recommend, in case a child might bump it, they clean it. I watched that in the webcast and everything that Amy did. So rubbing alcohol, forget it. You can't find that anywhere. So you're very scarce on using that. And cleaning supplies. And when I do find that stuff, and even bleach, finding bleach. I'm fighting with my husband. It's like, all right, you can have it this time because he needs it for his job. So I was like, all right, you can have it this time, or even like the Clorox wipes. You take it, I'll get the next one. So we have to, we have to keep the family, husband and wife going. So like, all right, you can have this one, I'll take the next one. And extra time, because you're disinfecting everything. So it's, so much extra time putting into it. When you get doors closed, extra time. And even during the day, because everything they touch, it's extra time. I'm putting less toys out. I'm using less space in my daycare. I have a ranch home, so my downstairs is all completely daycare. I don't use it down here anymore except for nap time. All my toys down here are covered up and put away because the soft stuff, I don't get out because you can't clean that.
Right.
I just get out, even wood blocks, you can't really disinfect that because you can't put the bleach on it. It's going to soak into the wood. So I'm, watching what I get out for them to play with. If they can't get in the tub with the Clorox water, I'm not getting it out. I'm watching and I'm limiting what they can get out and what they can play with. So I feel like I'm being a Scrooge on what they can get out, but I have to watch their safety. So it's time, with what they get out, what they can play with. And keeping up with the change of, the rules, the regulations, what to do, what not to do. And I feel lucky in this sense because my daughter-in-law is an RN, or my daughter is an RN. So that helps me, on some of the stuff too, and the changes and everything.
So this is good. So, all 3 of you, in terms of the biggest, dealing with challenges, you found a support system. So for Maggie, she has the hospital. She's very fortunate to have the hospital there. For Tanya, she has, because she's part of a large multi-site organization, she can work with her colleagues, some who are open and some who are closed. And then Tina, you have some personal connections with family to kind of help support some of the work that you're doing. And I think that I think that what that's telling us is, as we open our doors, we need to look for our support systems. And as Maggie, you said, you were able to turn to Amy, which is, and that's what Amy is going to be there for, to kind of help us navigate this opening. So if I had to look at, if you guys have been operating now for, since March 13th, before that, you kind of picked up and ran into the fray, so to speak. So when you think about the challenges that you've had, and you had to come up with a single aha moment, oh, I can do it this way. I can face a challenge in this way. What might that, I know I've switched this question a little bit. What was your aha moment that said, oh yeah, this'll work? Maggie, what do you think?
I think once we had our drop off and pick up procedures in place, and then the cleaning practices in place, and what the staff would and would not be wearing, wearing a mask requirement, whether they wear a gown or have changes of clothes available to them because they're going to need one or the other. Having all that done, I'm now comfortable fully opening. I'm looking forward to fully opening because although my enrollment's low, there's a lot of families who would love to be here right now, but they can't because they're not considered essential workers. Right. So they can't come in. And they are excited to come in. I'm hearing from them. Whenever you're open now, the kids are ready, the children are ready. A lot of my teachers have been making phone calls this week, and the parents they've actually talked to the kids as well on the phone and had those conversations. And every community family, for the most part, I don't think there's been one yet, they're ready. When we open, their intent is to be here at our center that day. So that's nice to know that they have that faith in us and they're ready to come back. I think I feel comfortable that my staff is ready. I just have to get those staff who have not been working with us from the beginning. I need to get them in and train them on what we've been doing. Once I have that, I feel comfortable. I'm not saying we all have the fear of what happens, but we've been living with that fear, and we have our policies and procedures, or whatever you want to call it, in place, ready to go if it comes. It's a drastic fear, and my stomach goes in knots every time I hear parents say they're being tested, because that happens, and you're going to hear it. And the first couple of times, you're going to knot up and be panicked inside and having to keep it together until those results come in. But we never have, knock on wood, thank God, and I want to make that clear, never have had that in our center. But you know, when you're dealing with essential workers, you know they're at risk.
Yeah. So you have so you're dealing with I mean, all three of you are dealing with populations that are the most likely, okay, because of what they do every day, to have been exposed to COVID-19. So, slow opening has helped, because you can put those procedures in place with pickup and drop off. Like limiting who has that exposure is one thing I would strongly suggest. Limiting who greets the parents, does the temperature checks, and does all of that. It should be the same people day after day. And that came right from my health system. That was before the CDC ever said anything. My health system said you limit the people who could have the exposure to those who could possibly be exposed. So that is the one key thing I would recommend to everybody. And I think once you get that in place, and if you follow those CDC guidelines and the guidelines that Amy, if you were on the webinar yesterday, which I was, Amy, wonderful information, if you follow any of that guidance, you may not have to do it. You're going to have to make it work for your center, because every center is different. But if you use them as a guide, you will figure this out. In the beginning, you're going to get frustrated and coming from fear, which is normal and understanding. But you will get through it. That's what I want to say to everybody. You will get through this. You will learn to live in this new world. And it's scary, I'm not going to lie. The hesitation is there, but there's going to be a time in life, whether you do it now or you do it 3 months from now, because we now know COVID is not going to totally go away. You're going to have to face this. If you want your child care center to be in business, at some point you're going to have to get up and face this. And you're not alone. We're all here. I'm here. Call me. That's, I think, the biggest key is talking and communicating with each other. Thank you, Maggie. Tanya, what do you think, turning to you, what do you think your big kind of like, aha, I can do it this way? And what I thought was a challenge maybe is doable.
So again, it was that drop off. And working with our client and talking to our client, we switched our entrance. We had the capability to have a whole separate entrance versus using the same entrance as the client. And, at first I thought, oh, how is this going to work? But then I just thought, take a minute, think about it. And again, with my ed coordinator, we just stopped and we thought about it and set up our own little makeshift desk at the end of the hallway. And really, it's that communication too, and having somebody to bounce ideas off of and somebody that you to. And, similar to Maggie, we have a process that we go through, and our parents come in, they stop at that station, and we do a health check there. And then from that point on, parents don't go any further. We take the kiddos, we take them into the classrooms after we do the health checks, and they go straight to wash hands. And then after health checks are done for the morning, we actually go and we change our clothes for the day. And then those clothes either go straight to the washer or they get sealed up to go home and be washed. And so it was really just thinking through the process. What is this going to look like for us? How can we get a check-in station set up at the other end of the hallway versus our office in the normal lobby, and have everything that we need so that we're not going back and forth and we're just in one spot. And I mean, it works out well. And because we're the two that check those kids in, we don't go in the classroom. So we don't cover lunch breaks. We don't go into ratio because we have that interaction with every child in the center. So really looking at every aspect, every angle of it, and just making sure we have it thought out and seeing what worked best for us. It really was just taking the time to think about that. And, you know, and being on Amy's webinar yesterday, as she went through things, it does give you a peace of mind as she's going through them to say, we're doing that. Okay, we're doing that. So
it's doable. I mean, I think that both what you and Meg is doable.
It is.
So you know, and I know I've talked to Tina about this too, but in part, it's first stopping it at the door.
Yeah.
And then moving into the center, and what we do, you know, once we get past that door, is really important too.
Yeah, and we have families who are saying, if the restrictions are lifted to yellow and we can return to work, we're looking at coming back on the 11th. So yesterday we sat down as an admin team and said, if these families truly come back on the 11th, you know, we're adding 4 to 6 more kids in the center. We're actually going to move our check-in station outside to our playground. We have a covered area where we can do that. And we just feel safer as we add more people to the mix to just take the decision that Jen and I have made is that we want to just move that outside. And one thing we're going to be doing next week is hosting little Zoom meetings with each of our individual classrooms so that we can keep that contact with our families who are not here to share with them. These are updated protocols. This is what we're doing on a daily basis, because it's really important for them to understand what you're doing. They've been disconnected for 8-9 weeks. They don't know what's happening at the center level, and they need to have that sense of comfort when they come back to the center. So we want to be able to have a chance to talk to them, to share all of our enhanced protocols, what is happening at the center on a daily basis, and give them a chance to talk to us and ask us questions. So when they do start to come back, they have, you know, they know our expectation and they have an understanding of what's happening, and they feel some sort of comfort level as well before returning.
I think that you're raising a really good point about communicating with your parents, being able to share. You've been able to handle this during the highest point of the pandemic, and this is what we're doing to keep your children safe moving forward. And I think that's keeping in contact with families is so very, very important. So thank you. Tina, what would you say was your kind of aha moment about, when you said, oh gosh, I've got to do this. How am I going to do this? I could do it this way.
I think when I came up with my a new COVID-19 sick policy,
okay,
I wrote it down and I had all the parents sign it, and then I gave them a copy of it, and it kind of like outlined the new rules. Like they can't bring any outside toys or anything in. Also, it outlined the children, they had to have, they couldn't have the fever. And I added on to it, besides the fever, I added like rash, diarrhea, all the other symptoms of the COVID, and added a couple other symptoms that they couldn't have. And I also added on it, if they had any of that during the day, the parents had a half hour to come and pick it up, their child, after I called them. And they couldn't return until they were checked out by a doctor. So, and I had the parents sign it, and then I gave them a copy of it to take home with them. So I called it my new COVID-19 sick policy. And then also had on it outlined that if the drop off, that only one parent can come in at a time, and that they can't bring any outside toys at all in, nothing but the child. And their coat, naturally if they have a coat, with this time of the weather and everything, and it went in their little cubicle bin, and that was it. And only one parent's drop off, and that's it. No other sibling, no other parent or anything like that. And it was all right there, and they got a copy to take home.
Great. We have the policies as Tina. I'm glad to hear somebody else is doing the same thing. We also have the parents bring their lunches in Ziploc bags. That's the only thing that's allowed and sheets and blankets that once they're here, they stay here. We took on the responsibility, since we're fortunate to have a washer and dryer. We're washing and drying them. And it's, my staff is actually the group, like I said, we did this as we went. They came to me and said, this is what we want. We feel it's safer. And since then, other people have been doing it, and I think it's a great thing.
Mm-hmm. Thank you. I think that, so we've got, I'm just doing a time check. So it's 11:30. I know that people have lots of questions because about, we're buying extra supplies, we're cleaning, we have fewer staff, we have fewer children, so I'm going to start with Tina on this one. So Tina, what kind of impact have you seen on your operation costs? Like, have you had to spend more money? Is it costing you more to serve children today than it was in February?
Definitely in cleaning, extra paper towels, that kind of stuff, definitely more in those areas. And because if you can find it, you try to stock up, and especially now they limit it. And like I said, I try to get my husband to go with me, and then again, he needs it for his work. So you kind of go out the store, go back in and try and get it again. And you just can't go to one store and get it. So you're going to multiple stores. It's like a whole day you're spending trying to get like 1 or 2 containers of cleaner or 1 or 2 containers of bleach. So you're spending a lot more time. You got the gas time plus your time. You're spending a lot more in those areas.
Mm-hmm, mm-hmm. Yeah, I was on an email chain this morning about purchasing supplies. So that continues to be a big challenge. Tanya, when you look at your budget, where are you seeing the increases in costs? We can already anticipate some of how the revenue may have declined, but where are you seeing the cost increases?
So definitely with our cleaning supplies, we are certainly blessed in that our client supplies all of our paper towels. And so they come in, they do all the paper towels, they do all the hand soap. So for us, we're very lucky that is something the client comes in and they replace daily if needed. Mm-hmm. It's something that we don't have to look at, but when it comes to the sanitizing wipes, and our company has been able to find hand sanitizer, so in getting hand sanitizer, that cost has definitely increased. The one thing that we've been very mindful of, though, is looking at other costs and making sure that we're cutting all the other costs. So obviously the food supply, trying to keep that at an even, food is down, maintaining labor to make sure that we're not, so trying to keep the operational costs somewhat even, but it is higher in the cleaning supply area for sure.
So you're monitoring your budget is a really important aspect of kind of monitoring how you're responding to COVID-19.
It definitely is. We actually have a spreadsheet that we use, and anytime we purchase anything, we plug in that receipt so we can see how much we're spending in each area to see, are we over, are we under, and then we have a reporting system, so then I can share that, this is why we're over in that area.
Mm-hmm. Very good. Maggie, where have you seen increases in the cost to operate your program? And could you estimate like what percentage your budget may have increased as a result, or your costs have increased as a result?
But for us, it would be cleaning supplies, and that's the hardest thing to get. I would say right now I've lost a lot of revenue because you put a freeze on those community members who can't use the center. Right. So that really hit our budget more than the cleaning supplies did.
Gotcha.
To pay my staff, and that's why they just literally this week they were either furloughed or hours drastically cut. They were already doing it, God bless them themselves. They voluntarily did it. They didn't need to formally do it, but it got done formally beyond my control. But I would say the cleaning supplies, and it's more, it is more of an issue. It's going to definitely increase. I can't tell you right off the top, because right now I get it through the health system, so it's different for me than it is for everybody else. But I am getting limited on what I'm getting sent down for us. Housekeeping, when they come in, we get our center cleaned every evening. And then I am lucky, we get like treatments that the centers aren't going to get. We get the cleaning and the fogs and all that they do in health systems to clean these rooms. We're getting the same thing. They're taking an active role to make sure our child care center is as much as possible germ-free. They are doing what they would do in a hospital, in a room, they're doing in this child care center for us.
Mm-hmm.
Some things going for us that most centers will never have. But for me, it's getting accessibility to the cleaning supplies. And I've done normally I get everything through the hospital. I've gone out and done some running around. My staff has done it, where we're getting certain supplies for the daily, all-day cleaning that we need to do.
Mm-hmm.
That's been toughest for us. So that's what I have to do now, is start to try to see if I can start to stockpile. I did have a stockpile, but again, we donate things back to the health system for the front lines back when it was the height of things, and then some things we cut back on ordering because we weren't bringing in the money, and my concern was making sure my staff were getting paid.
Sure. Sure.
So I didn't do all that. Now it's going to start to impact me when we do get into the yellow phase, hopefully sooner rather than later. But that's going to be the biggest challenge, is getting the cleaning supplies. Yeah. I keep thinking, one of the essential pieces that businesses that needs to open, if it's getting people in the warehouses to get the cleaning supplies done, that needs to go now so that we can open with the cleaning supplies. I'm more concerned about cleaning supplies.
I hear you. Okay, this is great. So thank you. So if you had, what is the single best piece of advice that you could offer colleagues planning to reopen their programs? And then we'll go on to the questions that people have submitted. So Tanya, let's start with you. What is the single best piece of advice you can offer your colleagues?
I think you just need to make a plan. You need to look at your center overall and think about what's best for your center, and really just kind of make a list and have somebody that you can talk to and you can communicate with that will help you with those ideas and help you put that plan into action and make sure that you're following best practices. And I continually go back to, again, for us, it was just never a hesitation about doing this. We wanted to be here for the kids, and we think about, it's really about providing them some sense of normalcy throughout the day, and this is their new norm, and they're doing so well with it. But really just looking at your center and what's going to work best for your center, and how do you make this the new normal. And the one thing that we've talked about consistently through this, and that we do at least weekly, is even though we still are all here as a team and there's only 7 of us compared to 18 of us, we have weekly Zoom calls with the staff that are still here, because while we're here, we're not all together like we used to be. So right. I continually check in with my team here via Zoom, because I want to make sure, how are you doing? Are you okay? And really trying to practice that social distancing with them. We're not in the classrooms like we can be, and we're not in the staff room like we can be. So every Sunday night, we get together for a short half-hour call, make sure if there's been any changes to the policies or the protocols, they're understanding that and just supporting them. And I think that's the other thing too, is checking in with your staff as they come to clock out. I just make sure I stop and say to them, how are you? Do you need anything? Are you okay? Yeah. Because it's hard for them to be here. It's very different. I have several staff that live alone, and now they're working alone in a classroom with kids. So just talking to them, just giving them another adult to talk to. And so while you're also looking at your center and the big picture of running your center, being that support for your staff is really so important too, and making sure they're being taken care of, and just have somebody to be there to talk to.
Great, thank you. Tina, what do you think is your single best piece of advice you could offer your colleagues?
I agree with what Tanya said about having a plan and everything, and a support team. Things are going to change, and keeping up to date with everything. And with being a family, we are by ourselves and everything. Right. But we do have a connection with other family providers and group home providers. And when we have a frustration or we have a question, we call each other. We have like a little network going, and we'll call each other, you know, like, hey, you know, do you ever have this situation? How did you handle this? Or did you hear of this change or that change? Or, you know, what did you do with this? And it's nice to have that support team. And especially in a crisis like that, you need that. You need somebody to call. You need somebody, you know, you're having a bad day or something. You need that. You need somebody to call and help you. And that is, I think that's your number one biggest thing, is to have that support. And, you know, it's going to change every day. You have to know, you just can't go in full force and say, this is it, this is what I'm going to do, and this is where it's going to be. Because it's not. It's going to change, not just day to day. It can change from the morning to the afternoon. Like you said, the governor's going to come on at 6:30, so things can change by then.
So
We don't know
everybody tune in. Yeah, everybody tune in.
It changes day to day, you know. You don't know what's going to happen. You know, you can have a child come in an hour, they could spike a fever, you know, and then all of a sudden you don't know what's going to happen. You might, you know, you're going to be calling like, what am I going to do? Do I change? Do I have to close down? You don't know what's going to happen. It can change. You don't know. That's the whole thing. It's, you don't know what's going to happen. You just having that support and know where to go for your resources.
Right. That's very good. That's very good. Thank you. Maggie, what do you think? What's your...
First, I want to say ditto to Tanya and ditto to Tina. They covered everything, but there's one thing I will say is, you know the saying, if you don't laugh, you'll cry. They're going to have moments like that. So I have taken time every weekend. It started where it was daily, and now it's gone down to weekends. And this includes the staff, whether they're working or not. I have a large group text for my staff. And I have, I think, counting me, there's 27 of us. And I send one of those stupid videos, those sing-along videos of quarantine and all those videos. I search for a new one every weekend now to send to my staff to lighten the mood, because they need a little moment of laughter. They need that, because they, especially the staff here, God bless them, that have been here through the whole thing. Yeah. They have been my huge support. I have grown to love my staff more than I thought I could ever have before. This has truly made us united as a group. We're a family. We're not just co-workers now. We went through a war together. We're still battling, but we're still there. We're in it together. Listening to your staff, I think letting them, like Tanya said, allowing them time to talk to you. They will allow you to talk too, because you need to talk too. And you have your colleagues, but your staff can support you just as much as you can support your staff. So having that trust in them and the faith in them, and to really listen to what they have to say, because you know what? I don't have all the answers. Sometimes my staff have better suggestions, better ideas. They help put things into place as well. So listen to your staff, laugh, cry together, be prepared, allow them to be angry, because they're going to be angry with you in the beginning that they have to come back to work, because and that comes from fear. Mm-hmm. It comes from fear. Recognize that and give them the ability to express themselves. And you're going to have your own thoughts. Find somebody other than your staff in the beginning to talk to. Find another director to let those things out. Eventually, you'll be able to share with your staff once you get past that initial phase.
Yeah, I hear you. I hear you.
But well, honestly, everything that Tanya said and Tina about everything is, I just ditto it.
Terrific. Terrific. Okay, so thank you to our panelists for providing this kind of insight into what they've been doing in the trenches over the last 6 or 7 weeks. Now what I'm going to ask is we'll turn to some of the questions that we had, and if Maureen and Sean could share some of the questions that have come up from our participants or on the call, that would be great.
So there's a lot of questions about masks and children and group sizes and social distancing.
I would also add there are a whole slew of questions about, for the open providers, have you had a case of COVID among staff or kids? And if so, how do you handle it in terms of safety, in terms of confidentiality? I mean, there are just like so many questions around that. They're all really good, but we want to know, have you experienced that?
So let me ask. So following up on the question that Maureen shared about the masks, Tanya, you and I talked about how you were helping children adapt to the concept of wearing masks. Could you share?
So when we started wearing masks pretty much right off the top, in fact, I think it was, as soon as we opened on March 16th, within 2 days, I think we were told, get the masks on. And then it was, do you have surgical masks you can send up, and is there a way to get cloth masks? Because the front line needed it. And we had no problem. We had boxes of it, but we sent it up. My secretary, God bless her, started sewing masks, and we had to get them approved by it. But I work for a health system, so anything you can cover your face with, your nose and your mouth. And let me share this, because this is something not everybody's going to realize, and I got this from my health system. I literally had to be trained on it and train my staff on how to use a face mask. If you're using a cloth face mask, you want to be sure that you're touching however, whether you're tying it on your head or tying it behind your ears. When you put it on and off, that's how you want to touch your mask. Same side of the mask should always be touching your face. Don't flip it. I mean, there's been that for a while that went around, but I'm going to say to you, my suggestion is do not flip it. Wash it. Wash it daily, if not in between. At least wash it daily. But I would suggest the same side, always touch your face. And when you take it off, again, using whether it's tied or around your ears, that part to take off. When you take it off to eat, I would put a clean paper towel down and lay your face mask down with the outside part, the part that was on the outside, on top of the paper towel. So the side that was on your mouth is up. And then eat, enjoy what you need to do, and then put it back on again with the way I told you to put it on. If you're going to store it and not wash it, whether it's a normal surgical mask or it's a cloth mask, you're going to fold it in half so that the outside is touching the outside and placing it in a bag. And then when you take it out, put it on the same way. That's just to help reduce your exposure. Make sure you're washing your hands between it each time you touch your mask. And if you see your colleagues, this is going to be the hardest part, wearing these face masks, is people constantly touch their mask. When you touch it, go sanitize your hands.
Good. Tanya, you were telling me when we talked about how you were getting the older children used to wearing masks and how you introduced the concept slowly, and some of the games and some of the songs that you were singing with the kids. I know that there's some hesitation from your colleagues, because I've heard from some about wearing face masks, and it is guidance. But share just some. Could you share some examples of how you were kind of getting kids adapted to the concept?
Sure. So all of our teachers wear the masks. We don't have our kids, but to get our kids just into that routine of seeing us wearing the masks every day, seeing the teachers wear the masks every day, the first thing we did was communicate with families. I think that's so important. What is your child's comfort level? Have they seen this? Can you wear them at home? Can you let them know teachers will be wearing them? And then we asked them, can you spare an extra 5 to 10 minutes in the morning so that we can have time to talk to them? And then parents would come in, and obviously that appropriate social distance, and then so that we could show them, this is Miss Tanya, and I would just take my mask down so that they could see it with me, and then I would put it back up, and then we would talk to them. In the older classrooms, and even in our toddler classrooms, we actually developed lesson plans. We have, his name is Olipop. He's our health and safety hero, or she, and she's our health and safety hero. And we actually, Bright Horizons she's a little puppet that comes out with them. We do health and safety lessons every day with her, and she wears a mask. And in our health and safety lessons, we talk about why is it important to wear a mask? Who wears a mask? What are the reasons you would wear a mask? How do you properly wash your hands? And the kids actually made masks with Olipop, and they put them on their baby dolls. They put them on the puppets in the classroom. And Olipop goes to the sink, and they sing a song about washing hands with Olipop. And we have videos of Olipop washing hands with the kids. We even went so far as to send a flat Ollie home to all of the kids that are not at the center. And then they've taken videos or pictures of Ollie doing health and safety items with them at home and sent them to us. And then we put that on Facebook for all of our families to see. So it's really helped them, especially our ones who were very hesitant to the whole mask concept and seeing their teacher in a mask. It's just been very helpful for them to see, and doing those lesson plans with them about why do we wear a mask and how do we keep people safe. And, you know, one of the little friends even said, my mom said there's a sneaky virus around here and that's why you guys have to wear a mask. And he said, but when I wear my mask, I keep doing this a lot. And he showed us, and I said, you're right. And I said, that's why we don't have you wearing it at school, because you're touching it a lot. So we just talk to them a lot and be very open and honest, but the lesson plans have been very helpful in teaching them about and educating them about it.
Terrific. So I'm just kind of flipping through the questions myself. And, you know, I think that I know that I've talked, you know, so one of the recommended pieces of the CDC guidance is keeping children six feet away from each other during the day. And I know that we've had conversations with family child care providers, especially during nap time, how you do that. But generally, how are you working around the guidance about separating children, you know, giving them space, you know, while they're at the program? Anybody want to take that up on that?
I'll start. I would say for us right now, it's not an issue because we're so low that we're able to do it. That's probably the next concern I have is when we open up fully to everybody. How are we going to do it? It won't be 6 feet per se. And that's another reason why I'm not rushing to fill the spots of people dropping, because when they drop, that gives me more space per child, more space to spread out. We do have a large room that if we need to, we could move a class in there. We are combining 2 pre-K classes because we dropped a lot in pre-K. Parents are figuring, well, it's the summer, school's out, I'll just pull them out because they're pre-K, they're going off to kindergarten. So that in a way has helped because now that gives me, I have a room basically that if you think about 15 children, it's a little more than a classroom for us. It's like a classroom and a half. That gives me more space. I can spread the children out at nap time. So I'm okay with it right now because we're trying to do the 6 feet. But again, as a guidance, we're going to do the best we can. We don't have the children like Tanya. We don't have the children wearing masks. It's just the staff and I.
Okay. Some people were asking that was one of the questions that came up. You know,
if they wear the mask, just causing more problems in spreading germs.
Understood. So this was a question I think in part Karen answered earlier about capacity limit. So someone asked, you know, do we believe that there will be a capacity limit on early childhood, on early learning centers when we're able to reopen? Do you think that there will be group size limitations? And that's maybe a question for Amy too.
So I can, at this point, I can say, again, until we hear otherwise, folks need to go with the current certification regs and try to implement the CDC guidance as much as possible. You know, there have been different conversations, and I'm not really sure. It would be speculation for me to say how they're going to come down on things. But I know that there have been conversations about, you know, is that something that should happen? And I don't have an answer to that yet. The goal I know is that they would, if they were going to implement those kinds of things, that they would get that information out. Ogdell's been advocating for them to get that information out as soon as possible, because we know you can't decide if you're going to open if you don't know what those parameters are. And so we keep emphasizing that. I think the other thing to kind of keep in mind, I can't count how many times each of these 3 ladies has talked about the fact that things change and things change quickly. So I think people also need to be prepared for the fact that we might open with certain conditions, but as we learn things, or as we, you know, either we learn about how programs are operating, or we learn things about the virus, things might change, and they need to be ready to get to have either the Department of Health or DHS through Ocdell tell them something different. I think the other thing folks need to really kind of be prepared for is that Octal is going to try to do, as much statewide kinds of communication as we possibly can. But there might be times where we're communicating to a specific region because it applies to them. So we know that folks, you have peer relationships and you talk to one another. So don't freak out if your friend in one region heard something that you didn't necessarily hear. Keep reaching out to your certification rep. They are going to be the best person to tell you if there have been any changes that have gone beyond what our current cert regs are. If there are any additional orders that are placed, anything like that, they are going to be the folks that are going to really be able to tell you what's the difference between what is actually required and what is actually recommended, highly recommended.
Thank you, Karen. There's some other questions. I mean, that I think that they're projections now because, until the governor makes his announcement this afternoon. But there've been a number of questions about how you, okay, this is my bird clock. Okay, how you're handling callbacks of staff. Like if a person chooses not to return due to an underlying health issue, have you developed policies yet on how you plan to deal with that?
Diane, can I add in that some of the
Sure.
questions also kind of further refine that and as are you handling staff callbacks differently for people who are in a high risk group just by virtue of their age as opposed to other staff who are not?
Yeah, that's good. Thank you.
So Diane, is that question for Octal?
No, I'm sorry. That's for the panel.
Okay.
I'm sorry. That was generally for the panel. I'm sorry. No, not for you. No.
Yeah, thank you, because I'm like,
you're welcome. No, you can't make that. You can't make that call, Karen. You can't make that call.
You don't want us making that call.
No, we don't want. No, they don't want you making that call. So,
Holy Redeemer, Diane.
Yeah.
My staff, honestly, 50% of my staff is in that age group of at risk. They've been with my center for 20, 30 some years. And they've been here since day one with it. The way I think it depends on each place and your policies. I'm fortunate I have a human resources department. They will guide me through that process. I think if you're going to consider all those things, my advice would be get a lawyer to talk to, guidance from a lawyer just to be safe, because you don't want to, you have to be try to be fair in what you do. I just go back to all my trainings with Rama Gutkin and other trainings I've had, and that's a sticky wicket. I would get legal guidance.
Yeah, it's the same for us. We have a human resources department, and we've just worked with our staff and looked at their cases, and some of them have medical reasons and they can't be here right now, and that's okay, and they have medical documentation, but just working with HR as we look to start to call staff back and just kind of working through those case by case to say, okay, are you able to come back? This is when we would need somebody. For example, we need somebody next week, and then there's a whole process that they have to go through before they can even come back. So they have to be able to answer all of the questions on our health screening. And if they don't pass all of those questions on our health screening, then unfortunately we have to bypass them and move on to somebody else. So there's a whole process for us before they would even be able to come back to the center.
I'm muted. So were there other questions, Maureen, that you saw that the panel? I mean, we're right at the edge of our time this morning.
Well, yes, there's lots of questions that we haven't gotten to. I guess one specific one for Octal, since we don't have much time, for counties that are able to open, will that include pre-K counts as well as childcare because of the Department of Ed piece within pre-K counts?
Yeah, so I mean, you're going to want to really keep in touch with your preschool specialist, but because the short answer to that is no, that your pre-K counts and Head Start supplemental programs they've made the decision to pay the grant in full, but you're going to be doing you're working online with kids through the end of this school year. We also understand, though, we're a mixed delivery system, so a lot of your childcare, and it's the same kiddos. You were doing wrap care. So you want to be talking with your preschool specialist about that. I mean, at no point do we want to say to a pre-K counts family, you're not coming because your pre-K counts, even though you need care. So you want to talk with them, and then also your ELRC, because you're going to be, obviously changing you were probably getting a part day rate for them from CCW before, and now you'd be getting a full day rate for them. So you want to make sure you're kind of checking through with all of those folks to make sure you're handling things the way that you should. And your preschool specialist will be able to help you figure out there are going to be some restrictions, because since pre-K counts teachers are still getting paid, and that how the idea of double paying them or double dipping. So there's going to need to be some real clear distinctions between the programming. But again, they're the best resource for you to think that through. But the last thing we want is for families to feel like they can't get care because their kid's a pre-K counts kid and they have to be online and at home.
Thank you. Okay, so I know we have, there were tons of questions here. So what we're going to do is we're going to sort through these questions, and we'll make sure that those questions that are applicable to Octal or are specific kind of health and safety questions will get to Amy. And then we saw that some people were looking for policies, so we'll share those questions with our panel. I believe, and what we'll also do is that those lists of handouts, in case you weren't for some reason able to download them, because if you're looking on a mobile device, you may not be able to download them. We will attach them to an email that will go out to everybody who signed up for today. I did want to share before we leave, let me show my, show my PowerPoint, come on, there we go. Whoop, this is going crazy. All right, let's see. Whoop, okay. Somewhere in here is my PowerPoint. There we go. That's what I wanted to show. Okay, so I did want to share this with you, and this will be in the handout, but Child Care Aware of America and Care USA are providing child care providers who are working on the front lines with a care package, okay? And that could be a gift card or a care package. Applicants must be a child care provider and currently open and providing essential care. And I don't know why it's doing funky things for me. Anyway, and providing essential care. So if you go to that website that is at the bottom of the page, there is an application. Not all states are eligible. Pennsylvania is eligible because the high number, unfortunately, of COVID-19 infections, and knowing that we have folks that are working to care for the children of essential workers. So this is kind of a plus, kind of a motivator, kind of a thank you from Care USA and Child Care Aware of America. I also wanted to share that we do have an action alert about covering the parent share of the copays. Karen can't say this, but Karen mentioned the piece about the stimulus dollars. And what we're doing with our colleagues on Start Strong PA is we are recommending that that the state look to cover the parent share of the CCW copay. So we do have an action alert. The other thing that I want to share is we do, one of the things that we found that for us and hopefully for you all, the most effective way and the most timely way that we can communicate with folks, and also to build that connection between your colleagues, is through PACA's Facebook page, which has been very active during this time. PACA members, there is a Facebook directors group that allows you to communicate also online through Facebook. PACA staff is available. Our email addresses, each of our email addresses are available on the PACA website under About Us. And we do this because we encourage folks, if you are not a member of PACA, we invite you to join us, and you can join us at paca.org. I want to thank all of our panelists today for joining us for, I think, this, which I hope you found to be an important conversation, and to know that our panelists today are doing this work and have been for the last few weeks. And so while this whole period of time has been scary, It's been frustrating. It's been, you know, as Maggie said, it's this roller coaster of up and down and sideways, not knowing what's happening next. The good news is that it appears that we're on the downside in a positive way as opposed to a negative way. When we first held our first webinar in March, it was the beginning, and we had lots and lots of questions. And while we still have lots and lots of questions, we're finally seeing some answers, hopefully. I want to thank you all for all of the work that you do and all the work you will be doing to make sure that you're providing a safe environment, an enriching environment for Pennsylvania's children. We know, again, we know if you have any questions, if you need support, please reach out. It's so very, very, very important. And watch the governor make his announcement this afternoon. Maureen, what time was that going to be?
I think it was either 2 or 2:30.
They keep moving that around, but
I
check
know,
the
it's really frustrating.
Yeah.
I just have 2 o'clock.
What was it?
2 o'clock.
2 o'clock. Okay. It's one of those things you just kind of watch every day and you go, oh, what did he just say? Okay. But this one I think is going to be really important. It's been whatever. Okay. So reach out, stay the course. It's doable. I know it's scary. But it's doable. Okay. We can do this when we work together. So again, thank you to Tanya, to Tina. I made you a new name, Tina. Tina, Karen,
I get
Amy,
that from the
and
kids
Maggie.
a lot.
So thank you all, and we'll be in touch. What we hope to do is a follow-up session to this one that'll really talk about budgeting, budgeting for post-COVID. Okay. You'll see a webinar. You'll see an email from us shortly. This webinar will be posted to the PACA website, and you'll get links for that too. All right. Have a good day. Take a deep breath. Have some lunch, iced tea, a big glass of water, or whatever suits your fancy. Okay. Take care.
Thank
Bye-bye,
you all.
folks.
Bye.
Bye-bye.
Is that it?